OCD.
Research has allowed us to understand more about the obsessive-compulsive disorder. It is a disorder that causes people to have unwanted obsessions and to repeat certain behaviors called compulsions over and over again. However, back in the late 1600s and early 1700s, OCD was thought to be caused by devils or other supernatural forces. Let's look at Ella. She's wealthy and she hires her servants to perform compulsive behaviors.
I'm controlled every day of my life. I need to banish the evil. Exorcism should work.
So OCD was claimed to be associated with certain brain areas with specific personality trait based on examining the different sizes and shapes of bumps on the skull. This is an idea known as phrenology and is incorrect. These different faculties consisted sections of will, emotion, and intellect. However, French psychiatrists such as Esquirol in 1838 could not decide whether OCD was caused by disorder of the will or intellect. Freud's theory stated that it produces obsessive thoughts provoking anxiety, and the ego tries to reduce anxiety by using defense mechanism. However, when these defense mechanisms fail to function properly, the symptoms of OCD would appear. This theory suggests that people with OCD will associate certain objects or situations with fear, and the result of learning how to reduce fears is to perform repetitive movements.
Serotonin sends signals between brain cells. When serotonin is released, it enters a receptor in the cell membrane. It controls the regulation of mood, impulse control, and pain. However, in OCD patients, some receptors block serotonin from entering the cell, causing the lack of serotonin in the key areas of the brain.
People who have OCD have more than usual activity in the cadet nucleus, OFC, and the thalamus. The OFC notices when something is wrong in the brain and it sends a worry signal to the thalamus. However, before sending the signals back to the OFC, the cadet nucleus that is located in between the OFC and the thalamus will suppress the original signals. However, in OCD, the cadet nucleus is damaged, so it loses control in regulating signals from the OFC. Ella is only 16 and she has moved to 10 different schools already because of bullying and isolation, so she has to go to homeschooling now. She's always locking herself up now and not wanting to eat anything. We have to help her. This is Diana Wilson and she has suffered with OCD for 26 years.
My earliest memory of the illness was probably when I was about 8 years old. I feared that if I did not always say my prayers, my mother would be killed in a car accident. I constantly checked the news to reassure myself that I have not murdered anyone that day, and I felt deeply upset by unsolved murder cases.
Those symptoms mentioned above are the common ones. Of course, different obsessive thoughts and compulsive behaviors will carry out differently according to different OCD patients.
Wow, I'm actually not alone.
To be diagnosed with OCD, the patient must meet the criteria spelled out in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. There is initial screening, and if the initial screening question suggests that one has OCD, the next stage is to check the severity of the symptoms by the Y-Box Clinical Administered Scale. Ella, you are diagnosed with OCD.
Will I die?
No. In this treatment, there are no side effects or risks. The first step in this treatment is to identify then modify patterns causing anxiety and compulsive behaviors. After that, ERP will be used. This exposes them with whatever causes them to feel anxious without carrying the compulsive behaviors. So Ella, what was your most severe example recently?
I would say the need to use 6 to 8 tissues to open a doorknob. I will be contaminated with germs and die.
You now will perform the behavioral experiment.
What?
Open this doorknob without using tissues.
Will I die?
Let's see what happens. Reassurance should not be used because reassurance ends up strengthening the belief that you really are responsible or capable of such things, thus keeping the anxiety high and driving the OCD cycle.
Another way is by associative splitting, as OCD patients show marked biases or restrictions in OCD-related semantic networks. They are encouraged to imagine neutral or positive associations to OCD-related cognitions.
Antidepressants known as selective serotonin balance neurotransmitters, such as serotonin in your brain, which help to regulate the communication between the different parts of the brain.